Hello and welcome to Facebook Live. We are joined today by two pelvic health medicine specialists. I am Michael Connors, your host. I want to thank everyone for tuning in and to remind you that if you have questions, feel free to post them in the comment section. And now I will allow these two ladies to introduce themselves.
Hi, I'm Dr. Eleanor Freely. I'm an OBGYN. I've been practicing for almost 30 years. And now I specialize in gynecology and pelvic health issues, especially around pain and prolapse.
And hi, I'm Peg Maz. I'm a physical therapist. I do women's health and pelvic health, and I work with people of all ages, actually, and all genders. And I'm happy to be here today to talk about postpartum health, but I also do all kinds of things. And Eleanor Freely and I work in close conjunction. We like to do a team approach, as we do throughout the big team at Swedish. I've been working in pelvic health for close to 30 years, and I see people who have issues with strength or weakness or pain, and often combine it with what's going on with their back and their abdominal function, etc.
Wonderful. So again, thank you both so much for joining us, and we're just going to get it kick-started with some of the most frequently asked questions that these two receive during their day-to-day. But again, if you have your own questions, feel free to submit them either via private message or the comment section, and we'll be sure to ask. But the first one that we had queued up is it normal for somebody to have urinary leakage after having a baby? And if so, how long? And then what can they do about it?
So as the gynecologist, I'm going to answer that yes, it's very normal to have urinary leakage after having a baby. And there's multiple reasons behind it, some of which can be nerve damage, some of which can be just stretching, and some of it can be ligament damage. But initially, it's also due to decreased estrogen, which thins the vagina. So for many women, as this progresses and as her estrogen comes back after having delivered the baby, she'll start noticing less and less problems with incontinence. And that can be 6 weeks, it can be 3 months. Some women have significant damage that continues to plague them for years, and then we have other issues that we can work on, and one of which is physical therapy, and we don't need to wait years to do that. And part of the reason we're talking to you is telling you don't wait for years. And then Peg gets the next step.
So when people come to us after delivering a baby, sometimes it's incontinence, sometimes they just feel aware of being weak. In fact, in France, apparently, it's a routine thing to go see a physical therapist after delivering a baby. And so what a physical therapist will do in the kind of pelvic exam that we do, will identify if the muscles are weak or if they are not doing what they should do because of fear of pain or some coordination issue has come up. And so based on what we find, we'll choose exercises or a home program that can address incontinence. And it's variable how long it takes to actually make it resolve, but people can oftentimes feel the improvement as it goes along.
Peg, I have a question for you.
Yeah.
Many women look up and they say, oh, do Kegels. How do you feel about that? Is that something somebody should start with? I always say what you do is so far beyond Kegels that it's amazing. But could you answer that?
Sure. So one of the problems, in fact, people who come see me hear me say that I don't call them Kegels because a lot of people misunderstand what Dr. Kegel meant and what we call Kegels, and so I just call it pelvic floor muscle exercise. But the first thing we want to know is if somebody's doing Kegels, are they actually activating their pelvic floor muscles or are they mostly using their abdominal muscles? Sometimes, if people are comfortable with it, I'll suggest to them that they put their finger inside their vagina and just see if they can feel a closure around their finger. It should feel like a closure and a lift. and it may be felt at the anal muscles, it may be felt at the vaginal muscles. It should be sort of that coordination thing. If people can do that, you can do that throughout pregnancy. You can do that right away after babies are born. And but sometimes one side is doing it better than the other side, and so I think it's oftentimes helpful to just have an assessment as you suggest. But yeah, we can get people started. If they really understand what a Kegel is, they can start doing it right away.
So that actually leads nicely into one of the first questions we received via private message. But are there any exercises or things that ladies can do to help prepare for having the baby, exercise-wise, pre-baby?
Again, that's in your
So
venue.
sure. So it's fine to start doing pelvic floor muscle strengthening. It's really a fine thing to do throughout life, and you can do it throughout pregnancy. There was a thought a long time ago that if you strengthened your muscles too much, it would be hard to have a vaginal delivery. A strong muscle is not a tight muscle, and so starting to do pelvic floor strengthening during pregnancy is a great way to help make the recovery of your pelvic floor better afterwards. Do you think the question was specifically about incontinence or just about exercise in general?
Mm-hmm.
I think keeping fit, we know that you have a much healthier pregnancy if you're walking throughout your pregnancy and keeping active that way. And if people don't have pain in their low back or their sacroiliac joints with exercise, I would do all kinds of exercises, clamshell type exercises, and I think just dancing around and walking is great. But keeping low back and hip muscles strong during pregnancy makes it easier to get through and to manage as you gain a lot of weight and then when you're trying to lose it after.
Perfect. So I'm going to keep the exercise theme. When can a lady get back to exercising after their pregnancy? And then does that change? Is that variable on the cesarean or versus the vagina delivery?
Yeah.
So from the medical standpoint, after a cesarean, we don't want people doing heavy lifting for the first 6 weeks as your fascia, which is the covering of the muscles, heals. It's not really that we ever cut muscles, or very rarely, but we want to have a good solid heal before you do any heavy lifting or heavy abdominal work. As far as if you have a vaginal delivery, it's based on how you feel with comfort, and we don't have the significant restrictions. But as to rectus diastasis, I'd like you to put a comment in.
So some people have, during their pregnancy, everybody has a little bit of thinning. There's a tendon that runs down the center of the abdomen that's called the linea alba, and abdominal muscles attach onto the linea alba. And as a belly expands, the linea alba stretches, and in some cases it splits or it thins so far that it seems like it's split. And it's not a painful condition. It's not like one of those things like, uh-oh, my linea alba just split. We call that a diastasis rectus abdominis, and it's been a lot in the news lately. A lot of people are reading about it. There's a lot more research that's just coming out about it right now, and people have differing opinions about how it should be handled, what it means. Generally, we try to get people, historically we've had people do abdominal exercises where they actually pull it together and do their abdominal strengthening, and the hope is that it will then close up and reattach. There's some studies now that suggest that really what matters is how you use your abdominal wall, and that even if that doesn't come together fully, as long as your abdominal muscles are working well, it protects your back from being injured. But in general, in the postpartum period, we like people to know whether they have a diastasis and know how their pelvic floor strength is, and know how their back strength is, and make choices for exercise based on that, which is one of the reasons we think it's great for people to get a physical therapy assessment in the postpartum period and just know how their body has responded to pregnancy, because it's so variable.
Even with a vaginal delivery, it's variable how the muscles are, how the strength is, and we definitely see a lot of that.
Okay, so you had spoke about diastasis recti. Would you just explain what that is for someone who doesn't know?
So that's what I was saying. So the diastasis recti is that when the linea alba, which is basically the tendon that runs down the middle of the abdomen, thins or splits. And sometimes people discover that they have it because when they go to sit up, they see kind of a ridge come through, like that protrudes down the middle of their abdomen, and it can be sort of alarming to see your belly sort of shape look so odd. And it usually happens during pregnancy. During pregnancy, there's nothing to be done about it. It's just there. And there's no way to prevent it as far as we know. We don't know. It doesn't seem like people are more likely to have it if they have bigger babies, smaller babies, or more fit, less fit. It's just, it may have something to do with what people's collagen type is and the architecture of how their body is doing the pregnancy. We address it afterwards. And that's what I was just saying about sort of figuring out how, when you use your abdominal muscles, does it draw apart and become bigger, or does it come together, and how's the abdominal wall functioning with it? And a lot of times we can get it to just come back together and it patches itself back up.
Thank you for answering that. So I have another question via private message, and is it normal to have pain after sex after having a baby? And if so, why do I have pain sex now when I didn't before?
So there's several reasons that can be. One, right after having the baby, and especially if you're breastfeeding, your estrogen drops really low. And that means that the mucosa, which is the vaginal skin, becomes thin, and it can tear, and it doesn't stretch as well. And so you can notice discomfort just from that. Now, that will get better, generally in about 3 to 6 months, as your normal estrogen stores come back up. Even if you continue breastfeeding, your estrogen levels will come back up to normal in 3 to 6 months. The other reasons that can be, one is that when you tear, especially after a vaginal delivery, if you have a tear or an injury, how it heals, how it's repaired can be different. And it can be, but rarely, can be repaired too tight. More often, it's a reaction that the muscles are spasming in that area, and they've been injured. And so that's part of the problem, is muscle pain and spasm. And if that's it, it doesn't need to have any surgery. You just need a referral to physical therapy. We do work a lot together.
I love the way you described that. That was a great way to put it. Yeah.
Okay, so another frequently asked question that you two receive is, does breastfeeding change what I should or shouldn't do about exercise or my diet, and are there any special considerations I should take?
In general, what breastfeeding, I mean, aside from your breasts will be larger, it's going to be a little harder to support them. So exercise that has bouncing to it, or maybe a little more uncomfortable, and you may need a stronger sports bra. That seems rather ridiculous to have to mention, but that can be a dramatic discomfort. It should not affect milk production or quality if you're exercising. You do need to watch your diet a little bit. A good, healthy, balanced diet is important because part of what your baby's getting is from you. You don't want to be too low on fat because the baby actually needs a high-fat diet to help build the coating around the nerves in the brain, which basically is how we insulate our nerves. And you do have to watch medications. Medications can, not all of them, but they can go through the breast milk, so it's important to know when you're taking a medication how much goes through the breast milk, and is this safe for breastfeeding. All medications are looked at as their safety level in breastfeeding. You can ask your doctor, you can look online. Alcohol is one thing that, although it's okay to have 1 drink per day, we don't know what the absolute level that is safe for baby, and it's recommended that you wait at least 30 minutes after having a drink before breastfeeding.
Do you talk to people about caffeine too?
So the most recent data on caffeine is up to 3 cups shouldn't affect baby's brain development, their agitation, or anything. So that's felt to be by the American Academy of Pediatrics to be a safe level.
Also, question for you: do you? I read somewhere about breast milk getting saltier sometimes with exercise, and that babies sometimes don't like that. Is that something you've heard?
No.
Okay.
Makes some sense, although that would be more. I wouldn't think that you would excrete a lot of salt into the milk.
I think with inflammation in breast tissue and stasis, I know milk gets saltier. People who have lactation pain issues that I see, but I was sort of surprised about that.
All right, so my next question for you, are there any devices or apps that I could or someone could get to help with pelvic floor rehab?
Oh, I get asked that a lot. You know, there's a certain amount of gimmickry to apps and devices. There are a number of devices out there, and I would be happy to sort of answer that specifically with people in my clinic, and any pelvic health therapist would. A lot of them promote doing things that create a lot of muscle tension, but they're not specific enough to make sure that they're really the pelvic floor muscles that are activating. So I'm not a big fan of the devices. And the other thing about devices is that while they sometimes motivate people, they take time to get in place. And I kind of prefer to give people pelvic floor exercises that they can do anytime, anywhere, because I think you're more likely to get them done that way. Some of the apps are great for your phone to just go off and remind you to do your exercises, and I think that can be helpful. And I think if you want to log what you're doing, and there are some apps for that. I couldn't give you the names of any of them at the moment, but I think I would just watch and consider, do I really need an app, or do I really just need to do it?
For sure, thank you. So the next question is going to stay in line with the exercise theme. If your back or someone's back is aching at the end of the day, are there certain exercises that they can do for that?
Oftentimes where I start with people who have achy backs in the postpartum weeks and months is to think about posture and body mechanics and how you're moving with your baby and how you're sitting, even like sitting if you're somebody who's breastfeeding or chest feeding. Do you have good back support as you're doing that? Are you bringing the baby to you instead of bringing you down to the baby? And analyzing your movement as your posture as you're changing diapers or as you're bathing the baby and things like that. So we really get good body mechanics, because poor body mechanics can really lead to backaches. And then the other part of that is, yes, you want to have good back exercises that really focus on endurance of your spinal muscles. I think one of the most basic great back strengthening exercises that really helps a lot of people is you can do it on your hands and knees, and you put one arm forward and your other leg backwards, and you don't put the leg up high. It's sort of called the ironing board. You try to be flat, and you try to hold that for as long as you can, and then you switch legs. And the truth is, you don't have to do it down on your hands and knees. You can do it standing and putting one hand on a counter or the changing table or whatever, and just hold that position. You want to give your back muscles endurance, so rather than going in and out of a position, to hold the position for as long as possible. And that's a great back exercise. You might want to just be assessed by someone who can help you identify what is specific for you in terms of what's going on with your back and what you need.
I see a number of women in the postpartum period who have different muscle aches and pains because you're all of a sudden doing a different job that you have to do 24/7, and you don't know the body mechanics to it. And, breastfeeding, carrying a baby around, changing a diaper, those are a lot of things that work not only just on the back, but also we see tendonitis in the wrist frequently. So if you're having some of these problems, please bring it to your doctor, get a referral to physical therapy, because there's so much that can be done to help you.
You started to touch on it there, but how would someone know if they should come see you and start looking for a referral to a pelvic health PT? What are some of the signs or warning signs they should look out for?
If you're having incontinence that doesn't go away in 6 weeks, if you have pain after sex, If you're having problems with your back, with your hips, with your wrists that seem to be new since having the baby, it's worth talking to your obstetrician or primary doctor to see they can help get you to the right physical therapy. Pelvic floor physical therapy is a specialty to itself and requires special credentialing and teaching, but it's really important sometimes to kind of have somebody try and part out which part needs to be dealt with and help direct you.
So if someone thinks they need to see a pelvic health physical therapist like Dr. Maas, how do they have to go through their primary care or their OBGYN, or can they contact a PT directly?
It depends on insurance, ironically enough. In Washington State, we have direct access. People can go directly to a physical therapist, but not all insurance supports that. So it really depends on what an individual's insurance coverage is. We like to work in collaboration with providers, either primary care providers or specialists, and because we like to problem solve together, and so it's never a mistake to talk first with your primary care provider. I think one of the things, as Eleanor was just saying that, I was thinking the statistics on how long people experience their symptoms before they ever let a provider know is really staggering, and I always feel terrible when people come in and say, "Yeah, I've had this going on for 3 or 4 years, or 5 or 6 years, or more than that," and so just really encourage people to. Even if it's something that feels embarrassing, or this is what we do all the time. So to come and talk to your provider and bring it up, and maybe the provider will say that this is within the scope of what we would expect. Let's give it a few more weeks before we send you to a specialist, or maybe they'll say, let's just get you checked out. So do mention it.
Yeah, and OBGYNs are there, and so are your primary care doctors, that you can ask us the embarrassing question, because that's what we deal with day in and day out. What our job is to try and help make that less embarrassing and to help make things work better.
So just to follow up on that, what are just some of the short and long-term benefits that someone can expect to see after working with you or someone like you?
Life is better all around. So in the specific, stronger pelvic floor maybe, or a pelvic floor that is a more skillful pelvic floor. Sometimes I talk with people about the fact that just as your grip is different for picking up a paper cup from what it is from picking up a jam jar, your pelvic floor needs to be nuanced in its function, and so sometimes that's strength, sometimes that's skill, sometimes that's just awareness of what it's doing, its ability to relax. So pelvic floor function, I will work with people on choosing exercise that is appropriate for what's going on with them, and also that fits in with your life as a mom. Now, what can you do that you'll enjoy doing? And so I help people with that a certain amount. I work with people a lot on how they breathe. It's remarkable how many people have a difficult time getting optimal breathing going, and that influences all kinds of things. So, and I have worked a lot in the mindfulness world, and so I'll work with people on what's going on stress-wise and what are your stress management skills, back pain, neck pain, sometimes headaches. The whole thing kind of comes together in postpartum physical therapy with people who have this expertise.
So we do have a question from the audience. So Mary Beth asks, if I have issues with healing after my first baby, is it likely to be worse with any additional babies that I do have?
In general, not. Because even if you had trouble with healing, if you have muscle spasm, that can be a little bit different, but there is a certain amount of relaxation that we see with the next pregnancy, so we don't see the same sort of level of injury or pain after a second or third baby. In fact, mostly second and third babies rarely will cause tears.
Wonderful. So we're getting close on time, so I want to just offer it up to both of you if there are any final talking points that you want to make sure our audience comes away from today's session with.
For me, some of the things that people aren't comfortable talking about. They're not comfortable talking about incontinence. They're not comfortable talking about changes in their sexuality and pain with sex, and just assume that this is the new normal. And you don't need to. There's so many stresses going on in your life just taking care of that, that new life, that it's important to spend some time checking in with yourself and making sure that you're taken care of in addition, because you're much better at taking care of other people, including your baby, your partner, if you take care of yourself.
I love that. I would say also, we're living in a time when there are so many sources of information that people are using to figure out what's normal for them and what they should do. And I want to really encourage people to make sure that the information that you're getting is reliable, and not just a blog or a website that might be selling something, but really ask a professional, and also just to know that your body and your response to what your body has just done is unique and unusual. Not necessarily unusual, but not usual. Not everybody has the same. There's no such thing as really super typical, and because your body comes at pregnancy from how tall you are, how big your baby was, but also what your fitness level was before, what your injuries have been before. So I think it's really helpful to get an assessment that's particular to you. And so that's my take-home message, is don't assume that what you read in a blog is true for your body.
Wonderful. Well, thank you both so much for joining us today. If anyone does have questions, there is an email and a phone number at the bottom of the screen that you can use to get more information from their team of experts. I want to remind everyone that you can like, share, and subscribe on the Swedish Facebook page to stay up to date with whatever our next Facebook Live opportunities are. And I want to thank everyone that joined us today, and thank you both so much as well.
Thanks.
Thanks.